Coming up on this episode of Freedom from Fire, we'll talk about medical emergencies. We'll look at the changing role of emergency medical services and what you can do to help someone in need until medical professionals arrive. So stay tuned to Freedom from Fire. Hello, and welcome to Freedom from Fire. I'm your host, Fire Commissioner Derek Sawyer. Here at Freedom from Fire, we'll bring you fire and life safety information and introduce you to our local fire safety partners. On today's episode, I'm going to talk about emergency medical services and community risk reduction initiatives with Captain Crystal Yates of the Philadelphia Fire Department. Later, we'll discuss mobile CPR training with Dr. Ben Abella from the University of Pennsylvania Center for Resuscitation. But first, let's look at some EMS statistics. When we compared call volume statistics over a 10-year period, this is what we found. In 2004, there were over 200,000 emergency medical incidents. In 2014, that number rose to over 280,000 emergency medical incidents. That's a 40% increase in the medical incidents over a 10-year period. There has also been an increase in fire department medic units in the city. There were 40 medic units in 2004, but since 2008, that number has risen to 50 medic units. This is a 25% increase in medic units in just a few years. Now let's examine the available emergency rooms within the city. There are currently 22 emergency departments in Philadelphia. 4 of the 22 are capable of treating children. Two of them only treat children. 5 emergency departments since 2005 include Women's Medical Graduate, St. Agnes, Northeast Hospital, and Germantown Hospitals. Those 5 hospitals have closed since 2005. 2 pediatric receiving emergency departments closed since 2007. There are 17 stroke emergency departments and 13 for acute myocardial infarction, which we call heart attack. Overall, Philadelphia has experienced a 21% decrease in emergency departments. As you can see, the demand for emergency medical services has increased while the number of emergency rooms available to serve the need has decreased. People call 911 for many different reasons. Not all are emergencies. In the past, when EMS providers responded, the only result was to transport people via ambulance to the local emergency department. The question is this the most beneficial course of action for the patient? Philosophy was we take patients to hospitals, and that was the extent of our involvement. A new era of healthcare is upon the country as a whole, promoting change from the reactive to the proactive. The new philosophy has become we take care of people. Here to talk about emergency medical services and community risk reduction is Captain Crystal Yates of the Philadelphia Fire Department. Crystal, how are you?
I'm fine. How are you, Commissioner?
Thanks for joining us on the show.
Thank you for having me.
So tell me a little bit about your career and what you've been doing in the time you've been on the job.
Okay, well, I started the fire department in 1998 as a paramedic, a fire service paramedic. I worked in North Philadelphia, I've worked in Logan, I've worked in Mantua. I got promoted to the rank of lieutenant in 2005. I did field operations supervision and administrative supervision. In 2013, I was promoted to the rank of captain. As a captain in the fire department, I worked for the Deputy Commissioner of EMS, We started the expansion of EMS in the city of Philadelphia, and now I've been tasked and trusted to start the community risk reduction program.
That sounds like an important job.
It is, sir.
So what is EMS-CRR, and how can it benefit the citizens of Philadelphia?
Well, community risk reduction is something the fire department has done for a long time. We do prevention efforts by installing smoke alarms. We tell people safety information whenever we go into a home. Our providers see something that's unsafe, they try to give the patient or the person information on how to reduce their risk of safety, their risk of injury.
Right.
So CRR formalizes that. We start keeping data on what we do to help people reduce their risk of injury, keep them safe, also monitor chronic injuries and illnesses so that we can make a healthy Philadelphia.
Nice. So I talked about the demand for emergency medical services earlier, 280,000 calls. Tell us about that.
Well, we're a busy system. We're one of the busiest systems in the country as far as EMS goes. So in 2014, we responded to 281,000 runs. I did the math. That is a run every 2 minutes.
Wow.
Every 2 minutes, somebody's
That's a lot.
calling for a medical emergency. We can't meet that demand as well as we should because it's going up every year. It continues to rise as the emergency departments close. So sometimes what happens is we deliver a patient to the emergency room, they're so full that we have to wait until we go out to help another patient.
Right.
So to help the emergency healthcare system as a whole, we should do things so that people don't need to go to the emergency room in the first place.
So what can we do to address that demand?
Well, we can educate people. We can educate people on alternatives to using 911. We've done a very good job of teaching people to call 911.
Right, yep.
We haven't always taught them what is appropriate for calling 911. So we need to reach out to the community and use our community partners so that we provide education on how to use 911, when it's appropriate to use 911, and other alternatives to 911. Your primary care physician is an alternative. You can get preventive health care so that you don't have to go to the emergency room. The city has free health clinics, they're an alternative. And if you really need to go to the emergency room, you don't always have to go by an ambulance. If I can tell a quick story that happened in my own home this summer. I'm doing work in the kitchen. I stumble, I fall.
Right.
I heard the pop. Our patients say, I heard a pop in my
Right.
ankle, and I did. I heard the pop. And I have a 22-year-old son and an 18-year-old daughter.
You don't look old enough.
Thank you. My 22-year-old son says, Jada, call 911.
Right.
And my 18-year-old daughter says, no, Jared. Mommy says people call 911 sometimes when they can get to the hospital another way.
Right, right.
You'll drive her. So he is a licensed driver. We got into the car. He drove me to the hospital. So we need to teach people that sometimes that's the appropriate thing to do.
So how do we target those people so that we can teach them?
Well, we target them by using our data. So every time we take a patient to the hospital, we complete a patient care report, and it's electronic and it's in a database. So we can query that data many different ways to find out who our customers are. We know who our high users are. We have a population in the city that is called a super user.
Right.
That's a person that uses 911 20 or more times in a 6-month period. We have super users. Some of our super users are facilities. Some of our super users are individuals. So we're reaching out to them so that we can work on other ways for them to handle their problems, because sometimes they're not medical problems.
Right, right.
We use that data and we know everything. We know our busy areas of the city. We know what times our runs come in. We have to go by data and not just anecdotal information. Or if you ask one of our paramedics, what is our busiest area, they may or may not be able to answer.
Right.
So we need to use the data.
All right, so community risk reduction talks about partnerships. That's an important component of community risk reduction, developing partnerships. Who are some of our partners?
Well, one of our main partners is Dr. Benabella's group, the University of Penn Center for Resuscitation. They're going to be starting a mobile CPR program. We're going to partner with them with that program. We have a smaller CPR program that's a partner run by one of our former paramedics, CPR and AED training network. We have partnered with the city's health department and their public health experts so that we can make use of their knowledge and resources, and we can help them as well. We partner with members of the community, and we've also partnered with some of our super users on working together to figure out how we can decrease their reliance on EMS.
All right, so we know that community risk reduction is important. Where do you envision the future of CRR going?
I envision the future of EMS-CRR growing. Like, I think that will become what is called in the EMS world mobile integrated healthcare. And what has taken place in the past is that you have a bunch of different groups working towards the same goal.
Right.
And when they're duplicating efforts and they're duplicating resources. If we work together, we probably can make a bigger impact. The synergy, the sum is more than the parts.
Right.
So my hope is that we'll grow to a mobile integrated healthcare program. We'll use community paramedics so that we can do preventive healthcare. We'll always respond to emergency calls, but I'd like us to get to the preventive side of healthcare.
That would be great. Well, you shared a lot of information. I want to thank you for joining us.
Thank you for having me.
Thanks. We're going to take a quick break, but before we go, our Man on the Street team went out again to quiz people on more firefighting facts. Test your knowledge with them and stay tuned for more Freedom from Fire.
Even though the streets are cold, we're inside heating things up with fire fun facts. Ready for some fun fire facts?
I am.
Okay. This is true or false. Dalmatians came to be associated with firefighters because they would run ahead of fire wagons and clear the path for horses.
True.
True.
That is correct. That's how we got our Dalmatians associated with firefighters. What is the weight of a fireman's equipment? Is it 65 pounds, 75 pounds, 85 pounds, or 100 pounds?
85 pounds.
75 pounds?
That's correct.
Really? Oh.
You're a lot better at this than you
And
thought
I did
you
not
would.
know fire trivia before this, so.
LaSalle has its first female president, Dr. Colleen Hanich, as you know. Who was the first female firefighter? Is it Molly Williams, Tanya Ellis, Cecilia Burnoff, or Elizabeth Jones?
The Cecilia was.
Elizabeth Jones?
It's actually Molly Williams. Molly Williams was a slave in New York City and became a member of the Oceanus Engine Company No. 11 in 1815. It's pretty cool.
Yeah.
Who is the official mascot for the National Fire Protection Association? Hector the Fire Detector, Chuck the Fire Truck, Smokey the Bear, or Sparky the Fire Dog?
Sparky the fire dog.
Ooh, Sparky the dog.
Sparky the Fire Dog.
That's correct. Sparky the Fire Dog was created for the National Fire Protection Association in 1951 and has been the official mascot and spokes dog ever since.
Oh.
This is your last question. Are you ready?
I am ready.
Awesome.
Okay.
True or false? Can you get a college degree in firefighting?
True?
False. Yes?
That is correct. True. You can get a degree in fire science. In fact, our fire commissioner, Derek Sawyer, received his associate degree in fire science from the Community College of Philadelphia.
Cool. That's awesome.
Yeah, so it's never too late to change that major.
Okay.
Cyberbullying comes in many forms and can happen 24/7. If you or someone you know is a victim of cyberbullying, take preventative and assertive action. Keep evidence and document all instances. Remember to record dates, times, descriptions, and also save and print screenshots. Block your cyberbully and present your evidence to school officials or law enforcement. No one deserves to be a victim of cyberbullying, and together we can end it. For more information, visit stopbullying.com.
I'm a writing center tutor, and I know more.
I'm an athlete, and I know more.
I'm a professor, and I know more.
I'm in Greek life, and I know more.
I'm an RA, and I know more.
If you see someone who may be at risk of sexual assault, step up and keep them safe. For more information about sexual assault and what you can do to prevent it, visit knowmore.org. Show your support by speaking out against sexual assault by using the Know More hashtag on social media.
On Fire. I'm your host, Fire Commissioner Derek Sawyer. On today's episode, we have been discussing EMS community risk reduction, and joining us now to discuss mobile CPR training from the University of Pennsylvania is Dr. Ben Abella. Welcome to Freedom from Fire.
Thank you. It's good to be here.
So tell us a little bit about your career.
Well, I'm an emergency medical physician, and I work at the University of Pennsylvania at the hospital of the University of Pennsylvania in that emergency room and former trauma center. But much of my time and one of my passions is thinking about CPR and cardiac arrest. And I've devoted the last decade of my career to finding better ways to train people in CPR and to saving more lives from cardiac arrest, which is both a big problem in Philadelphia and a huge problem nationally as well.
Right. So you said cardiac arrest. What's the difference between cardiac arrest and heart attack?
It's an excellent question. And many people do get those two terms confused.
Right.
So a heart attack, also known as a myocardial infarction, is when someone has a blockage to an artery of their heart. And that blockage causes chest pain. That blockage causes sometimes shortness of breath or other symptoms, and they need emergency care. However, in most cases, patients survive. In most cases, patients are conscious. In most cases, CPR is not required.
Right.
On the other hand, cardiac arrest is when the heart stops. So there's no heartbeat, someone collapses to the ground unconscious, and CPR is absolutely required. In fact, the response that is required has to be done right away.
Right.
You have minutes to save a life. Most people with heart attacks survive. Most people with cardiac arrest, unfortunately, do not survive. So that's the fundamental difference.
Great. How can we increase survival from cardiac arrest?
Well, the good news is there are tools available to improve survival, and they're tools at our very hands, and they're tools that the public can use. And a lot of our time is spent trying to educate the public that they can actually take an active role in saving lives. So if someone collapses, certainly we would activate 911. That's an emergency if someone collapses to the ground. If they don't respond, for example, to gentle shaking or calling out their name, and they don't seem like they're breathing, they need CPR. And CPR can be life-sustaining until emergency medical professionals arrive. The other key action is using what's called an automated external defibrillator, or AED. And AEDs are found in the public. They're in train stations and gyms and restaurants. They're becoming more common.
Right.
Using a defibrillator can also be life-saving and also is an action that can be done by any member of the general public. It's also important to tell members of the public that both CPR and the use of a defibrillator are legally protected by Good Samaritan statutes put out by the state. Many people ask me, will I get sued if I try to save someone's life? And the fact of the matter is, they will not.
So why is it important that the public participates in performing CPR?
It's essential for the public to understand that CPR is life-saving and that we cannot always wait for medical help to arrive. Although our medics do a good job of getting there as quickly as they can, cardiac arrest mortality increases by 10 to 15% for every minute that someone doesn't receive CPR. So for those minutes that we're waiting for EMS to arrive, CPR is required. And it can double or even triple the chance of survival. It makes a huge difference.
So the sooner we conduct CPR, the better. And what would you tell the public in reference to how they can learn how to perform CPR?
So it used to be felt that you needed a CPR class that would have a test and a certification, a 3 or 4 hour process. And many people are, quite frankly, they either don't have the time or they're sort of intimidated by this process. What we've come to realize is it's not required necessarily to go through certification, although we like the formal certification. And that really, as a practical matter, people can learn CPR from a variety of innovative approaches that only take 15 or 20 or 30 minutes. For example, the American Heart Association has a product, a video self-instructional kit. You can learn CPR in under 30 minutes. Other organizations offer CPR training. And our group at University of Pennsylvania is very eager to engage with the public and offer CPR training opportunities.
AED, that stands for?
Automated external defibrillator.
Great. Can a layperson use a AED?
Yes, although they sound frightening, absolutely they're designed for layperson use and they're simple to use.
Great. Our student producer, Mike Brown, shows us how to use a portable AED. Mike.
An automated external defibrillator, or AED, is used to help reverse the effects of sudden cardiac arrest. You can find them more and more every day in malls, schools, churches, and even airports. They're so easy to use that we're actually going to be able to show you how to use one over the next few minutes. If you find a victim unresponsive and pulseless, rapid use of the AED is necessary. First, stay calm and dial 911. An emergency medical dispatcher may be able to assist you and coach you through the steps of CPR, as well as let you know how to use an AED while emergency units are responding. Next, grab an AED and turn it on. This step is critical, as the AED will be able to use picture and audio cues to help you use your AED. Some AED models will turn on automatically. Most will not.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Next, remove the AED pads and follow the picture clues to apply them to the patient's bare chest. Ensure that you follow the pictures on the guide. Once the AED pads are applied to the patient's chest, plug in the pads connector to the AED. Once the pads are plugged in, the AED will automatically analyze the victim's heart rate. Do not touch or move the patient while the AED is analyzing.
Shock advised.
If necessary, the AED may prompt you that a shock is required to jolt the patient's heart back. If a shock is required, visually ensure that you and other rescuers are clear from the patient or anything touching the patient. When prompted, push the flashing button to deliver a shock to the patient's heart. You may see a slight contraction of the patient's muscles. This is normal. Once you've delivered a shock from the AED, resume performing high-quality CPR if you know how to, and wait for the AED to reanalyze until professional rescuers arrive. The use of an AED is so simple but so crucial in possibly saving the life of someone in sudden cardiac arrest. For more information, take a local CPR course or visit the American Heart Association and the American Red Cross. For Freedom from Fire, I'm Mike Brown.
Great job, Mike. So, Doc, what would you say is the best way to train a layperson in providing CPR?
Well, there's a variety of approaches out there, but one thing that I'm particularly in favor of is keeping it simple. And one of the proven approaches that is endorsed by groups like the American Heart Association is known as chest compression only CPR, sometimes also known as hands only CPR, where you don't actually need to do mouth to mouth. Mouth to mouth frightens some people. Some people think it's icky.
Right.
But in fact, as long as you're moving blood by doing chest compressions, you can save a life. And so we believe that's a simpler, easier, and more accessible approach to the basic learning for the public.
Well, I want to thank you for joining us today, and keep up the good work.
Well, thank you very much.
But before you leave, I have to ask one question, and that's to take the fire safety pledge with us.
I'd be glad to.
Great. Raise your right hand. You ready?
I'm ready.
I love my family.
I love my family.
And I'm responsible for their safety.
And I'm responsible for their safety.
Therefore, I pledge the following.
Therefore, I pledge the following.
I pledge to have at least one working smoke alarm.
I pledge to have at least one working smoke alarm.
On each level of my home.
On each level of my home.
I pledge to test my alarms as recommended and replace my alarms.
I pledge to test my alarms as recommended and to replace my alarms
with new lithium battery powered alarms when needed.
With new lithium battery powered alarms when needed.
I pledge that every family member will sleep with the bedroom door closed.
I sleep that every family member will sleep with their bedroom door closed.
I pledge to develop and practice a home escape plan.
I pledge to develop and practice a home escape plan.
I pledge that if I cannot afford smoke alarms, I will call the non-emergency number
I pledge that if I cannot afford smoke alarms, I will call the non-emergency number
311
311
or visit www.philly.gov/311.
or visit www.philly.gov/311.
All this I solemnly pledge.
All of this I do solemnly pledge.
Thank you for joining us.
My pleasure.
Now let's see what events we have coming up. Thursday, March 12th, we will be holding a graduation ceremony for the current class of Fire Service Emergency Medical Technicians. The ceremony will take place at 6:30 at the Fire Academy located at 5200 Pennypack. Come out and support them. This will be the second class of Fire Service Emergency Medical Technicians to graduate. Also, now that it's daylight savings time, I would like to remind everyone to change your clock and change your smoke alarm. Finally, I would like to take this time to send condolences to the Philadelphia Police Department and to the family of Police Officer Robert Wilson III. On behalf of myself and the Philadelphia Fire Department, you will continue to be in our prayers. Remember, if you would like to find out more about LaSalle TV, you can check out our social media sites. And if you are interested in learning about the Philadelphia Fire Department, visit our Facebook, Twitter, and web pages. I would like to once again thank Captain Crystal Yates of the Philadelphia Fire Department and University of Pennsylvania's Dr. Ben Abella. I would also like to thank you for tuning in and watching. So until next time, remember, fire is everyone's fight. So stay tuned and remain free from fire.